Hi, my name is Darian Hill, and I will be talking to you about death with dignity, also known as medical-assisted suicide. Death with dignity is the act of dying with the help or aid of another person. Death with dignity is an end-of-life option that allows certain terminally ill people to voluntarily and legally request and receive a prescription medication from their physician to hasten their death in a peaceful, humane, and with a dignified manner. It can also refer to state legislation codifying such as an end-of-life option, or a family of organizations promoting the end-of-life option around the United States. Prescription medications are the only way to carry out death with dignity, and the prescription must be obtained from your doctor. A legal prescription for life-ending medications is only available in states that uphold death with dignity laws. As of 2021, the 11 states listed above have physician-assisted dying statutes. In order to qualify for death with dignity, an individual must be an adult resident of one of the 11 states listed above, since they have the law in effect. Be mentally competent, which means they must be capable of communicating their healthcare decisions, diagnosed with a terminal illness that will lead to death within 6 months, and be confirmed by 2 qualified healthcare providers. The final requirement is that the individual must be capable of self-administering and ingesting medications without assistance. I believe that death with dignity should be legalized in order to allow patients who have terminally ill diseases the choice of how they die, when they will die, and end not only their suffering, but their family's suffering as well. Death with dignity allows patients the choice to end their fight without having to make their family members decide for them. This allows patients to not have to go through the pain of endless treatments or surgeries, knowing that no matter what they do, it will not save them in the end. There have been no reported cases of misuse of the medications during the 20 years Oregon's law has been in effect, as well as the 10 years in Washington and the 5 years in Vermont. The California End-of-Life Option Act states that a person who has custody or control of any unused aid in dying drugs for disposal by delivering it to the nearest qualified facility that properly disposes of controlled substances, or, if none is available, shall dispose of it by lawful means in accordance with guidelines promulgated by the California State Board of Pharmacy or a Federal Drug Enforcement Administration approved take-back program. Of the patients that use death with dignity laws, 9 out of the 10 of them are enrolled in hospice care at the time of their death. It is the responsibility of hospice to have a policy about the drugs left after a patient's death, including the legally prescribed lethal doses of medication, and to educate the deceased patient's family about the disposal of the medications. The objection that being in possession of a lethal dose of medication results in its misuse fails to account for any other medications patients around the country have. Death with dignity is the act of assisted death with the help from another individual. It is the act of allowing a terminally ill patient to end their life without having to suffer through treatments or surgeries that will not cure them. 11 states already have this law into effect and have not reported any misuse of the drugs that are prescribed in the many number of years that the law has been in effect in each state. Each state has more specific regulations that they follow to ensure that these medications are handled and disposed of properly after use. Death with dignity is a chance for terminally ill patients to not only end their suffering, but also their family's suffering. They will be able to remember their family members smiling and happy in their final stages, rather than lying in a hospital bed unable to open their eyes. These are the resources that I used in order to make my presentation today.